or seeing the slides, then please let us know. Just wait for a few more people to join. Lovely, we've still got some more people trickling in, I think. So yeah, as I say, hopefully you can hear me okay. Just to note, we are recording this session, so it will be available to watch on a link via our website at a later date, but that does mean that if you want to turn your camera on, just be aware that if you speak, your face may appear on the recording. So just to make you all aware of that. I think we'll probably get started. Yeah, okay, brilliant. Well, thank you so much, everybody, for joining. As you know, this is the CEP Innovate Health, the Foundation series. And this is a 4-part webinar series that really is just designed to give you a bit of an introduction to innovation in the context of healthcare, and hopefully to give you some inspiration with your own innovation, whether that's an idea you've got already and you're hoping to refine and develop it, or whether you're somebody that is just interested in coming up with an innovation for the first time. So I think we have people joining this call from a range of different professional backgrounds. We are the NHS Clinical Entrepreneur Programme, which is part of Anglia Ruskin University. And I think we have some ARU students joining the call, which is great. We also have some NHS staff members, and I think possibly some clinical entrepreneurs or patient entrepreneurs from our programme already, which is brilliant. If you don't fall into any of those categories, you're still very much welcome. We did run this series in July, and we had some people coming to this from a patient perspective who are interested in innovation. So everybody is welcome. We do hope this will be a bit of an interactive session in part, so you're more than welcome to type in the chat if you have any comments, ideas, questions. The team will be manning the chat as the webinar goes on anyway. There will be the opportunity to ask questions, and we will hopefully, if I can get it to work, we will hopefully do some breakout rooms at some point as well. So yes, welcome. And final thing to note is you will be able to get CPD points for this series, but you do need to attend all 4 sessions live, so you do need to join them. So as I say, this first session is just a bit of an introduction to innovation in that healthcare context. Next week, next Thursday, we'll be looking at sort of developing, brainstorming innovative ideas and really trying to understand the problem that you are trying to solve with an innovation. After that, we will have a session that looks at sort of a business plan, so a 1-page lean canvas business plan, so you can test the sort of feasibility of your idea. And then the final session will look at pitching, so communicating your idea to others, particularly to important people who might help you to advance your innovation. So just by way of introduction, my name's Jenny Petty. I'm a Programme Support Officer for the NHS Clinical Entrepreneur Programme. And I'll just pass over to Tamsin, if that's okay, to introduce yourself. Thank you.
Hi, my name's Tamsin. I work as a paediatrician and I'm based in Cambridge. I've joined the team as the co-clinical lead for the Clinical Entrepreneur Programme. I have been on the programme myself, applying for the programme in year 4. So I had taken a device and an app into the programme, and but have later on joined the team.
Lovely, thank you, Tamsin. And Tamsin will be speaking a little bit today and next week as well, so thank you. Polly, if I could come to you, please.
Hello, everyone. I'm Polly Sullivan. I'm National Programme Lead for the Clinical Entrepreneur Programme, and I've worked on the programme since it began in 2016, so we're nearly hitting a decade with the next cohort. I look after all manner of different things, as we're a really small team, but events and curriculum is part of my job. So welcome to the session today. Thank you.
Thanks, Polly. And Lucy?
Evening, everybody. My name is Lucy Dentis. I am the Programme Manager here at the CEP. I look after all of our comms, our digital infrastructure, and I'm also really pleased to be working with the patient and dementia innovators programmes as well. So great to have you here. Thanks.
Lovely, thank you. So yeah, we have had a bit bit of an introduction to the programme already, but we'll just do a proper introduction to it for those of you who haven't come across it before or are potentially interested in applying. Polly, are you happy to give a bit of an overview?
Yeah, of course, Jenny. So the NHS Clinical Entrepreneur Programme is a workforce development programme to support the development of entrepreneurial ideas and innovations within the NHS workforce. So it began in 2016 when we just accepted junior doctors, but now in 2025 we accept anyone from the NHS workforce. We also have, as Lucy just mentioned, a cohort of patients and dementia innovators, and we work with all of the home nations in the UK now. So we offer the programme out to Scotland, Wales and Northern Ireland, and we have a cohort in the Republic of Ireland. We also have a cohort of crisis entrepreneurs that are supported by the charity Crisis. And the programme enables, as I've just said, innovation and entrepreneurial learning for NHS cohorts and NHS staff. And we do that through events called Pit Stops. Sorry, my dog's going to go a bit mad now. At the door. Events called Pit Stops, 2 days, workshops and webinars, mentoring, and access to less than full-time training that we can help with if you're a doctor in NHS. So yes, I'll shut up now. Did I miss anything there? The dog distracted me.
No, that was great. Thank you, Polly. Unless you have anything to add, Tamsin or Lucy? No? Okay, brilliant. Well, if you are joining this call, as I said before, because you're interested in applying, we have just announced our new application round. So it opens on the 3rd of November and it closes on the 28th of November. There is more information on our website and more information will be added in the coming weeks as well. But just so you're aware of that, if you are interested in applying. Lovely. So just to go very sort of back to basics really in terms of thinking about innovation and what it is, if we refer to a dictionary definition, we have here, for example, it's the creating and use of new ideas or methods. So it's that real focus on newness or novelty, and that's really important. And when we think of innovation, particularly in a medical context, you might always associate it with a device or a product, and it can be that. And we have many on our programme, Tamsin included, who have developed a medical device. But an innovation can also be a process. So it could be that you've come up with an innovative way of doing things that delivers operational efficiency at your workplace. Or it could be that you come up with an innovation that actually has many strands to it and together amounts to an innovative service. So the number of innovations we have in our programme and the type of innovations are really, really diverse. So it's well worth keeping that in mind. And when you read up on innovation, you can hear it described in many different ways. So, for example, you might hear of incremental innovation. And this is essentially a series of small improvements to an existing product or an existing process or an existing service. So it doesn't have to be a full-blown, completely new thing. It can be a new step or a new addition to an existing thing. And disruptive innovation, you might hear it referred to as that. This is when you might have a small company with few resources that enters an established industry, moves up market and challenges those more established larger businesses. And you might also hear of radical innovation. And this is when there's a complete kind of overhaul, a complete breakthrough that changes an industry completely. It could be completely new products, a completely new market, a completely new way of doing things. So the concept of innovation is very diverse. And if we think about what an innovator looks like, crucially, an innovator can be anybody, regardless of background, regardless of job role. And hopefully you're on this call because you yourself are interested in becoming an innovator. You might think of an innovator as well as being a bit like a sort of one-man band. So an innovator has to juggle many different priorities, many different things. And if you're coming to this from a clinical background, you might not have much experience in dealing with business or in dealing with legal considerations. And this is something that our program helps our entrepreneurs with. So in terms of the legal side of things, so sort of establishing a business, looking at intellectual property and whether you can sort of claim the legal right to own your ideas, but also things like medical device regulation. So if you were thinking of coming up with a medical device, there are those regulatory requirements you'd have to meet. And also from a financial perspective, you know, if you are setting up a business, thinking about how to approach your accounting, how to raise funding, perhaps doing grant applications. So an innovator sort of wears many different hats, and that's what this picture hopefully illustrates. And if you're joining us because you want to get started with coming up with an innovative idea, a really good sort of starting place is to consider the current landscape of the NHS and areas where perhaps innovation is needed more than ever. So as you've probably seen already, in September 2024, the independent investigation of the NHS in England was published. This was a report by Lord Darcy, and it set out key areas for improvement. So this is well worth a read if you're looking for some sort of, I suppose, inspiration for areas that could be improved through innovation. So key areas for improvement, as you can see, included people struggling to see their GP, long waiting lists, difficulties in managing within A&E, cancer care falling behind other countries, care for cardiovascular conditions not moving in the right direction. So that report is well worth a read. Another key document that you could refer to, which was published in January, was the Priorities and Operational Planning Guidance. So this set out some key objectives for the year ahead. And again, this could feed into an innovation that you're coming up with. So the key aims were to reduce the time that people wait for elective care, improve A&E waiting times and ambulance response times, improve patients' access to general practice and to urgent dental care, improve patient flow through mental health crisis and acute pathways, and access to children and young people's mental health services. So maybe you're already working in one of these areas, but it's well worth thinking about whether your innovation could target one of these key areas for improvement. And then more recently in July, the 10-year health plan for England was published. Again, this is well worth a read and obviously sets out the vision for the next 10 years. So there were three key shifts in this report. The first is this transition from hospital to community. Ooh, got a line on the screen, ignore that. And so this is underpinned by the idea that care should be as local as possible, digitally by default, in a patient's home if possible, in a neighbourhood health centre when needed, and then finally in a hospital if necessary. So that idea of not making hospital the default area to receive care. Another key shift was from analogue to digital, and part of this is the use of the NHS app. So the idea of giving patients real sort of control over their care, planning, and giving them access to their records, for example. It also includes things like continuous monitoring of certain health conditions to allow for patients to proactively manage those conditions. And the third key shift was from sickness to prevention. So again, this idea of empowerment, and the overall goal here is to halve the gap in healthy life expectancy between the richest and poorest regions of England while increasing it for everyone. And this includes, if you read the report, initiatives like restricting junk food advertising, banning 16-year-olds and under from buying caffeine drinks, for example. And the report also sets out some other key areas. So this change in how the NHS is sort of managed, a new operating model, a new transparency of quality of care. And this includes reforming the complaints process and also using patient-reported outcome measures and experience measures to give patients the chance to sort of choose a provider via the NHS app. And there's also a focus on improving the NHS workforce in the sense of making sure that staff are better treated, more motivated, have more training, and generally just more scope to develop their careers. And then innovation is outright mentioned in the report to really drive that healthcare reform. And it identifies 5 key transformative technologies. So there's data to enable earlier diagnosis and better health research, AI to support patient choice and to liberate staff, genomics, so preemptive personalised care from birth, wearables to make care real time and become standard in treatment, and robotics, so to support with precision and transforming patient care from surgery to rehabilitation. And then the final point here is about productivity and a new financial foundation. And just moving on to the next slide, in September this month, a planning framework for the NHS in England was published. And this is all about there being a rolling 5-year planning horizon, which is underpinned by 5 key principles, and it also sets out the key sort of levels and roles and responsibility of planning. So at a provider level, at an ICB level, at a regions level, and at a national level. So although I've just whizzed through that, and I'm sure many of you have come across and read these documents already, but it's just a really helpful reminder of a sort of starting place. So if you are thinking of developing an innovation, think about what the current landscape is like. What are the key areas that you could innovate in? And if you have an innovation already, reflect on perhaps whether it links back to any of those key priorities. So what we thought we would do now, just to hopefully give you some inspiration, is go through some examples of innovations from entrepreneurs who are on our programme, again to sort of show you how diverse innovation can be. It doesn't look like one thing, it doesn't have to be one type of innovation. And on our website, you'll be able to read more on these, but it's just to give you a bit of a taster of some different examples. So I'll come to Tamsin first, if that's all right, Tamsin, who will give us a bit of an introduction into what inspired her innovation and what it is. Thank you, Tamsin.
Thanks, Jenny. Great run through, thank you. And so lovely to see you all here. And well done, everyone, for putting their names in the chat. Go for it. It's great to see the diversity of different roles, and it's great for you guys to start to build that network and make sure that everybody knows who you are. So it's fantastic. And I just want to say that I can see that there's huge diversity in there, and the everybody is completely welcome. It doesn't matter if you haven't qualified yet, you are equally as welcome as the consultants who have been established for many, many years. And that is one of the things that is really, really important about the programme, is that whilst we're all at different stages of our training and development within medicine, we are all in a learning about innovation. That's why this series is here, and that's why the programme exists, because we are all in the same boat from that point of view, and we all need to learn from each other. And it's different from the NHS like that, and I think that I found that really, really helpful, because when I was on the programme, I needed to hear from all the different roles and the people, because it helped massively. And one of the things that Jen was keen on me going over was the problem that I was trying to solve, because this is the introduction to innovation, and thinking around the problem that you want to solve is maybe the foundational bit. And so I started as a paediatrician, and I was a community paediatrician, and one of the clinics, I was doing several clinics, but one of the clinics I was asked to take over was the children who had hearing loss. And I was looking into different medical reasons for why children had hearing loss. And it's not like I was very fast at working it out, but as we work in the NHS, we start to see patterns in our patients. We've got this incredible privilege to be able to see patients with one particular condition in a clinic and be able to work through the different ways that people are dealing with that and what they need. And the way that the NHS has been set up is, it was all set up yesterday, and we have to think about what tomorrow looks like. And one of the things that the national lead, Tony Young, who started this programme with Polly in 2016, talks about is how important it is that you realise how important your own thoughts and ideas and innovations are. There isn't a separate group of people who are actually going to think about what medicine looks like tomorrow or the future. You are what the future of medicine looks like. So I think I'd started without particularly understanding any of this, and I had been in my clinics and I was starting to see a pattern in my hearing loss, particularly the hearing loss clinic, where I was realizing that the children who were born with a hearing loss were maybe in some ways being better served with behind the ear hearing aids or cochlear implants being quite quickly delivered to them, and there was a system around that. I know that there are problems within every system, but those children had a better plan than some of the other children that I was seeing, which was a much more common condition, which was where children got a bit of a hearing loss when they got a cough or a cold because they got congested, and their anatomy is so small that they stayed congested for a long period of time. And it's a condition known as glue ear, and the medical term for that is otitis media with effusion, which no one can be bothered to say, so they call it OME. But anyway, glue ear is what the patients call it. And glue ear is simply where you get some fluid that's stuck behind the eardrum after a cough or a cold or an ear infection, an acute ear infection. You're left with a bit of fluid behind your ear. And then I was seeing those kids. So what we were doing in the NHS process that I was taught, which was, if you see a kid with this particular type of hearing loss, let's wait and see if it gets better. And if it doesn't get better over a period of time, then start thinking about referring on. So then as a paediatrician and over about a decade, I'm noticing that some kids, they have a hearing loss and we're waiting, I mean, it wasn't rocket science. If they're waiting for a long period of time and they're the kind of kids that every time they get a cough or a cold, their hearing goes down, then you wouldn't believe it, but it's harder for them to access education at school, speech and language skills. Children are small and they're trying to learn to read, they're trying to learn to spell, and they're struggling at school, and they're struggling with their speech and language skills, and they're starting to fall behind. And I started noticing that these kids were the kids that we perhaps weren't serving as well, because we kept thinking that they might get better and it might be okay, and we were slower in the pathway. And I guess that after seeing quite a lot of kids who maybe were just not doing well with that system, that I thought, well, I think that if a child can see very well for that period of time, that maybe we would give them a pair of glasses so that they could see the board. But we are letting kids go to school for long periods of time, not being able to hear very well. So my very, very first piece of research was, how long are these kids with glue ear waiting before they get an intervention? And so the clinical pathway at the time was, you go and see, let's say you start off, you might have a school hearing screen, or you might go and see the GP because you think your child can't hear very well, because you're a great parent and you think maybe that's the reason that they're ignoring you, or their speech and language isn't very good. So then the GP sends them for a first hearing test, then they wait 3 months to see if it clears up, and then they have a second hearing test. And then if it still hasn't cleared up, they still can't hear very well, they go and see an ear, nose and throat surgeon. And then if they say, oh, you still can't hear very well, then you might get something called a grommet operation, or you might be considered for hearing aids. So it turns out that that's 5 clinical encounters before you get an intervention. And however fast anyone is working, 5 clinical encounters gets to a year pretty quickly. And you don't really need to be a paediatrician to know that if a kid can't hear very well for a year, that's going to impact their development potentially. So there was 2 things that I was seeing. I was seeing that kids couldn't hear very well who had glue ear. They weren't being given a quick enough intervention to help them, and they were falling behind in their development. That was the problem that I saw. And I think that initially, I very naively had a look, and there was a type of hearing aid that already existed that would work very well. It was a type of hearing aid that worked by bone conduction, which works perfectly because it took sound as a vibration, and it actually sent it across the bones of the skull to the inner hearing system, which was in the bone. So you can just completely route sound round the eardrum, which is where the problem is sitting, where the fluid is sitting and impairing the transfer of sound. And so there was a wonderful hearing device, but where I was here, that cost £3,000. So I was all prepared to put this new intervention on them. And then colleagues were like, what are you doing? This is such a bad idea. This is £3,000. You're talking about this glue ear is much more common than being born deaf or having a permanent deafness. It's almost 100 times more common. And so who's going to afford the £3,000 hearing aid for these kids that you're going to put on them? Like, the NHS can't afford it and parents can't afford it. One of the things that I think I should have done, and it's something that I learned on the Clinical Entrepreneur Programme, and for those of you who are thinking around your problem, I learned by the type of, like, this type of diversity that you've got here right in front of you here, with all of those different types of people working in different systems, I needed to think about the problem in more of a 360 view. So I was very focused on my own view, my own clinical view. And I understood also about patient views. So, and I did a little bit of work where I put some patients in, like 5 patients who had been through the usual pathway, nothing to do with what I wanted to do, just who'd been through the usual pathway, and asked them, oh, what do you think of this pathway? What was the problem with your child? And they all said, well, my child fell behind with speech and language, or my child had really bad behaviour and got really, really tired at the end of the day and had meltdowns and I didn't know how to parent it. Or, you know, it felt like no one really understood because the teachers didn't know about glue ear. So I didn't really know that well. So I understood that perspective. But what I needed to think about also was, what was the perspective of the audiologists? How could I, if I was going to do something, I needed to do something for the clinical person, but also for the parent. And then what was I going to do for the audiologist? Can I make it simpler for them? Because they will only adopt it if I can make their life simpler too. And what about the speech and language therapists who are seeing these children, who are trying to get these children to pronounce things without having hearing support? And then what can I do for the ear, nose and throat surgeons later? Like, can I solve anything from them? Or if I create something, does that get in the way of what they're doing? And then what about hospitals and the management system? Like, can I streamline that? What am I doing? Like Jenny's run through, like those 5 priorities and those 3 government priorities. Like, how am I going to do that? And you can work out, it's just that don't think of it one-dimensionally. There's a proper 360 way to look at this, and you can come up with a really good problem. Well, you can, you know the problem, but you can think about the problem in a way that helps you get the best solution that fits for everybody. So what I was focused around with this problem was, I need something cheap that helps them to hear quickly, that is affordable for the NHS, and it's affordable for patients. So, and I went on a very long journey, and I created a hearing aid that works with the same bone conduction technology, and instead of £3,000, it was £50. So that solved that particular problem. Many things went wrong on the journey, but essentially, thank you, Heather, for the heart. I think the other thing is that I was worried about children falling behind in their development, and so there was 2 things I wanted to do. One was help those children to hear, and thanks, Joseph. And then the second one was stop children from falling behind in their development. So I think that so I wanted to help with a hearing device that cost £50, but I wanted to create an app, which I did with a charity. So I said so I did a charity partnership in order to keep the app free, and I created an app which helped children to work on their developmental skills while they had glue ear until it resolved. So there were several different things that I could do with that. So I almost had 2 innovations. And when I turned up on the programme, I had a pretty ugly first version of what I thought it would be. And it's turned into something a little bit more beautiful. over time. But I think that it was really important then for me to think around, in fact, and I can match everything. I can think of how I can support audiologists, how I can support ENT surgeons. I can help audiologists by this child can be supported quickly. Your waiting lists can be completely are fine because this child can hear and can be supported with the app while you're waiting for this particular child to get this. And then, in fact, what happened was I had an opportunity during COVID where, in fact, all children's hearing services shut, for me to say, I can actually support all of these children by sending it by post. So I ended up, this is the little bone conduction headset kit, but and I'm details of the app, and I could put that in the post to people, and I could follow them up remotely like this, and then end up capturing that and writing a paper on it. And then the interesting thing that happened there was that once I'd captured some of that, and I really struggled, this is not that I was a researcher beforehand, I had never written a paper, and in fact it was very difficult for me to get funding because I didn't have that experience beforehand. But it's not impossible. It's fine to be in that position. It's fine to, one of the things that the programme will do will give you the tools to be able to get yourself into being able to apply for funding, into being able to explain your innovation in a way that makes sense to the hospital manager, the clinician, and the parent. And so it might be, and the person who's paying for it might be completely different to the person that's using it, and that needs to make sense to both of those people. So when you're thinking about your innovation, think about it from as if you are sitting down as a different person each time, and how you're going to make life easier for that person. And it makes it easier for you to get funding and to get your idea through. So I think that one of the things that was quite helpful for me was being able to support children then with this over COVID. I wrote the paper. I had to beg for help from a retired academic who helped me write a paper in the right sort of way. But then what happened was, by writing the paper, the press picked up on it, and then the press did a little press release to many different press offices, not just in this country, but in other countries. And then what that led to was low-income countries saying, well, we don't have anything affordable for anyone here. And then I realised that what I'd done was focus on the problems in the UK. Now, I definitely had not thought bigger than my clinic initially, and I certainly would have laughed you out of the room if you'd have said think wider than the UK. But of course it's important. If it's important for the people in front of you, we absolutely are in a very, very privileged position to be able to share that innovative knowledge and understanding and the research that you've done. And it doesn't even matter if the whole thing hadn't worked. The research should be shared so that someone else knows you don't do it that way, or you do it that way. And I think that I didn't know to think that big initially. But then what I realized is that, in fact, if you take all of the children who can't hear globally, 90% of them sit in low-income countries because their hearing loss is really affected. They don't just get coughs and colds, but they're not vaccinated, and they haven't got antibiotics. So when they get glue ear, they get it really badly, and their eardrums break down, and they have discharging ears. And not only that, but almost none of them have got access to hearing support. And it's a much wider problem. And so now what is important to me is to think about, how do we reach those children? Because if they end up with a hearing loss, they can't access education, however determined they are, and they are determined to try to get themselves out of poverty. But because they're stuck and they can't pass their exams, then they stay in poverty. And the very, very first child that I put a hearing headset on, this £50 headset on in Malawi, has now went from failing all of her school exams to passing her exams at the end of each year, and then wanting to and passing her school certificate at the end, and then being able to apply to be a healthcare professional, because what she wanted to do was to help other people to be able to access hearing support or overcome any of their disabilities. And that's now become her lifelong journey, is to make sure that that happens for her. So when you're thinking about it, and thank you everybody for your lovely emojis, but when you're thinking about it, think big, dare to think big, because sometimes you think, what, me, I can't talk, oh, I can't say this, I don't know if this is important enough. But actually some of the stuff you're doing, we are in a privileged position to be able to do it. We have an amazing program. The NHS is huge, and we have this one opportunity for everyone to be in the same room, inspiring each other, helping each other, explaining how best to get that solution out there. So feel empowered. It doesn't matter if it's not a device. I mean, I had a thing, right? I had an app and a device. Doesn't matter. You can be changing a pathway or changing something, a structure within your hospital. It doesn't matter. Wherever the corner of the world is, you need to be in a program where people can support you to get that out, so that you can make a difference, so that we've all got a vision of what the future of medicine looks like, but how are we going to get there if we don't have people like you? So we need you on the programme, and thank you for joining tonight, and I'll tell you about the rest of the story another time.
Thank you so much, Tamsin. Yeah, really inspiring, and loads of great comments. Lots of people really appreciative for you telling the story there. I don't know if anybody has any questions, and you're welcome to, if that's all right, Tamsin, you're welcome to raise your hand if you have. I know, Irina, you've asked when you joined the programme, Tamsin, how far along in your project were you? I wondered if you could answer that, or Irina, feel free to unmute if you want to add anything.
Yeah, no, that's great. And I think that, don't worry about that. Some people, so about 40%, in fact, Lucy and Polly will probably be able to explain about this, but 40% of people are at an idea stage. But you want to be more robust than just like, I had this idea. So you want to be able to back it up with, do you know what, here are some statistics on this particular problem. Even if they're not your statistics at this point, but if it sounds like you understand the problem, you understand the background knowledge, and you know where your idea will fit in, that is absolutely fine. I was actually at the point where I had a very ugly, so just a very bad first version of my headset. And actually it went through so many iterations that it was nothing like this. I mean, nothing like this. It was, in fact, the first versions were so bad that I realized all the bits that I needed to do to make it better. So it's a long journey. When you want to change the system, we all know the NHS is difficult to change. Change management is really hard in the NHS. You're going to move that tanker incredibly slowly. So just pace yourself. And it doesn't matter if you're very early stage. And I sometimes wish I had been on the clinical entrepreneur programme at a much earlier point, because I was making a few mistakes that I would have avoided. And I needed to build some confidence in myself about whether I dared. I mean, at the beginning, I wasn't sure whether to tell people, and I felt very alone in my paediatric department at the time. My colleagues are lovely. I love them to bits, but I was doing something that was different from patient care, and I was uncertain about that journey. And so I think that I would have done better with that support earlier on. So don't worry about it being very early ideas stage, but also, and it's almost slightly surprising to me, but I do understand it. Some people who are completely mature and have they're ready to roll out something, or have rolled out something and have got first customers and have set up their business, will join the clinical entrepreneur program. And we need those people equally as much. They need the network. They need to have people that they can speak to about things. Everybody needs to keep innovating around their, however mature their product is. And they need to have all those conversations. And they need to be able to be put in front of the right people. And this program allows those opportunities to happen. So whilst I actually had something that, a thing that I was able to bring along, I think I should have started earlier. So don't worry about it being early stage, but justify it well when you're there, because it's a competitive process. So make sure that you understand that problem and have thought through it and can make a good case for why your idea should be taken seriously and should be part of what medicine looks like. So don't worry about it. Yeah, I can see other people saying that confidence is a massive thing. And yeah, imposter syndrome, I completely understand. I also think that, I mean, Jenny spoke about it as well. Jenny was talking about what does an innovator look like? And I felt like an innovator didn't look like me, which, you know, let's just change that for a second. Why not? It should look like all of us. And we should be able to call ourselves innovators. And I think that sometimes the name entrepreneur is a little bit punchy when we're talking about the NHS, because I was like, oh, entrepreneur, oh, that's a bit different. That's all right. We're entrepreneurs. That is what we can do. That is a skill set that we can grow in order to launch an innovation that we know will help patient care. There are many things wrong with the NHS. It is brilliant, but there are many things that you can work at, that you can think about. So probably, and one of the things I thought was someone else must have thought of this problem. I can't be the only one, but you know, so but actually I'm the only one really have. So you feel confident that your voice is important to put forward as someone who can advocate for patients in that area. Sorry, Jen, I'm not really, the IP situation, we go over all of that. I also didn't have any experience with that at all. And that was very complicated for me. But there are ways that you can work around that, and we do address all of that in the programme. And it is not always black and white. That you ought to also know that one of the things that the IP, is intellectual property. So owning your idea, and sometimes the hospital want to kind of like work with people who work in the NHS. And there we have access to lawyers and access to people who understand IP. And in some ways it works incredibly well for people to work with their hospital within an IP agreement, but it helps to know about that. So IP means intellectual property, and it is a good idea. Thank you for mentioning it, because it is something that is nice to think about early on, so that you feel like you are leading on that. But yeah, quite right. That's probably a whole session in itself, and it's something that we look at on the programme. Was there anything?
Thank you. Yeah, I think there was just one question from Zach. He said, did you have to go through the MHRA for approval?
Yeah, and so the MHRA is the Medical Health Regulation Authority. So yeah, that's a great question. So when you have anything, including an app, and this is something that, again, you can learn about on the programme, even if you don't understand or have knowledge about it at this initial point, was a lot of apps become medical devices if they have certain functions, like they measure something. And we have some wonderful, wonderful, wonderful resources that help people understand that very early. As it happens, and this is probably a bit odd, I worked with the Medical Health Regulation Authority, MHRA, and they felt, so my hearing device is actually not a medical device. It's an assistive technology. So like a walking stick or something, it's seen more like that. So as an aid to daily living is one of the terms that the MHRA use, and that's great because it keeps it very affordable. So that worked really well. I was in discussions with them for the long period of time. So that took time to get to that point. But my app actually is a medical device because I have got hearing screen on it. So my app has got ways for children to do games that help their listening skills and their auditory processing and their speech and language skills. And I've also got a little hearing screen on that. So it depends what you've got in your app. Don't worry, there are perfect those type of regulatory things are well addressed in the programme, and we have clinical entrepreneurs who've been through the programme who will also talk you through it. And we've got lovely partnerships with people who in that regulatory area, and it does help to think about that early. So thank you, that was a great question, but if you haven't thought about it, don't worry, and it's something that will be covered.
Thank you, Tamsin. Brilliant. There is just one more question, and if you have got a question, we could always just save that till the end. But there is a question in the chat saying, how did you juggle clinical work and innovation time-wise?
Yeah, no, that's great, and great to talk about it. I think that initially I was doing clinical work and then I was doing my innovation. So yeah, hopeless. I'm sure a lot of other people are doing that on their call. It's quite interesting, isn't it? And you can do it as part of audit projects and quality improvement projects, and you can find ways to do it within your job initially. And if you're really brilliant and you somehow manage to get some innovation or research time, then some people do that very well. By being on the Clinical Entrepreneur Programme, some people have good conversations with their line managers or medical director or whoever it is that they're speaking to, and have negotiated having 1 day a week within their job plan. A lot of people have not particularly done that, but there is an opportunity, and having the sort of badge of NHS Clinical Entrepreneur, sometimes that makes hospitals quite proud to have that, and they are quite good at now building that in. And some hospitals are looking to try and have innovation more carefully put out in job plans. So I think it's going to possibly get a little bit easier. Certainly this programme has grown because of its importance in the NHS. So you may be open to discussion with your line manager about it. If not, then I started by doing both at the same time, which is very exhausting, and you have to look after yourself if you're doing both things. And I think that very slowly you can end up moving your clinical work depending on what's happening with your innovation. So slowly, so there's something very protective. Polly knows this because she's been looking at statistics on this since she started the programme, but it's actually very protective for you to start an innovation alongside a job. So your innovation is much more likely to be successful if you stick in a job first of all. It does mean you have to go slower in innovation sometimes, but you are more likely to get to a point where slowly you might be getting some income, or you might be able to balance time more exactly. So that's one of the reasons why the programme works, because having a job makes it more protective.
Thank you, Tamsin. And yeah, thank you so much for talking to us about your innovation. As I said, if you do have any more questions, we probably will have some time at the end. So please do feel free to keep them in your heads. We will just have a look at some more examples of clinical entrepreneurs' innovations, and also a patient entrepreneurs' innovation as well. But if there is anybody on the call who is part of our programme already and thinks they might like to perhaps share with everybody what their innovation is and what issue or problem inspired it, then you're more than welcome to, and I'll hopefully remember to come to you. So yeah, please feel free. I won't put anybody on the spot, but if you are in that position, you'd be very welcome to speak. So another example, just to give you a bit of inspiration and to show the diverse types of innovation that we have on our programme and that exist in general. Another example is Dr. Frances Duffy, who is a consultant clinical psychologist. And the problem or the issue that she has focused on is that people who live with dementia can frequently experience distress or have behaviours that can be very difficult for the people giving care to them. And this can cause a breakdown in living arrangements or could result in them being admitted to hospital. So in response to that, Frances has come up with a series of innovations, actually. The first was a sort of assessment process to look at the contributing factors that are causing behaviours and therefore to put interventions in place. She also created an app, the Clear Dementia Care app, which gives information about dementia, the different types, and really just to enhance understanding of dementia from the perspective of the person experiencing it. She also created an AI platform that has interprets data from connected smart sensors, apps and devices, and it models the daily routine of someone with dementia, a particular person. And then by analysing that, the AI model can identify what it might be triggering an episode of distress. And then by using such a model, you can put interventions in place. And then finally, she has created the 6D Dementia Training Platform, which offers accessible, comprehensive training for caregivers and healthcare professionals. And she recognises that one person experiencing dementia will come into contact with a whole range of healthcare professionals. So it's about giving everybody that access to key information. So that's another example. Another entrepreneur on our programme is Dr. Angus Perry, who is a GP. And the issue that he has confronted is that many GP practices can have different ways of working when it comes to processes like onboarding new staff. And there's often a reliance on paper-based information packs. So it's a very cumbersome approach. So in response, he created a digital hub called General Practice AI, which simplifies that onboarding process, puts all the information in one place, can be easily updated, accessible by whoever needs to access it. And by going on to integrate it with AI, it's evolved into an assistant that helps with sort of time-consuming tasks like writing referral letters, creating exercise prescriptions, creating mental health plans. So this is a good example of a sort of an AI platform that somebody has developed. And another example here is Neil Stevens, who's an innovative management consultant and healthcare researcher. And he and his company called Predictive Health Intelligence have focused on the issue of liver disease in respect of the fact that it progresses silently and many people don't experience any symptoms until sadly the disease has already progressed and has become very serious. So in response, he and his team created a case-finding search engine that empowers clinicians to use existing data to identify the patients who are most at risk of developing liver disease. So as a result, there's early diagnosis and it can be proactively managed. So this is yet another example. Now, Dr. Saif Ahmed is an academic consultant clinical oncologist, and he and his company called 52 North have focused on the issue of patients who are undergoing chemotherapy developing neutropenic sepsis. Now, this is something that could be managed well if the patient's in hospital, but if they've gone home and they have even mild signs of an infection, they are required to go into hospital. And this can be quite time consuming. It can take 1 to 2 hours for them to be tested. And in that time period, they're given intravenous antibiotics. But in around half of cases, that isn't even necessary. So in response, Saif and his team created something called NutraCheck, which is a low-cost finger prick blood test and a digital platform that gives quick, reliable results at home, so a patient can do it at home, and it helps doctors to then identify the patients who are actually at risk of sepsis. Another example, and as I mentioned, this is a patient entrepreneur, and this is Funmi Vanessa Alam. So as we talked about before, we have on our programme a sort of a small cohort of patient entrepreneurs, and they are people who have lived experience of a particular health condition, whether that's themselves as a patient or it may be that they're a carer for somebody who has a particular condition. And in this case, Funmi Vanessa's son has sickle cell disease, and she recognises the complexities of managing that condition. So in terms of drinking enough water, taking medication, maintaining a healthy diet, getting enough sleep. And so in response, she has created an app called the Eli app. And this has features just to help manage that condition. So it has features like mood logging, water tracking, reminders to take medication, symptom monitoring, and also a reward system that obviously would appeal to children. So it's been designed with children in mind. And it also has a pain diary, so it can be used to report back at outpatient appointments, for example. And she's developing this even further by integrating AI into the app. So it will make predictions that will allow parents and children to adjust their behaviours. It will give them that sense of empowerment. And then just a final example is Dr. Jim Kelly, who is a GP and musculoskeletal specialist. And the issue or the problem that he has focused on is that falls can cost the NHS more than £2.3 billion a year, and can result in accident-related hospital admissions and account for over 4 million bed days in England alone. And with particularly elderly people, it can result in hip fractures, which can then cause people to lose their independence and have to go into care. So in response, he has created with his co-founder something called the Trainer Gym Shuffler, which has a UK patent. So it's a mobility device that essentially can be used by sitting on the edge of a bed or in a chair, and it's for people who wouldn't be able to do traditional leg exercises. So it's safe, pain-free, exercises the lower limbs, and it builds strength in key leg muscles, and not only reduces the risk of falls, but also boosts blood circulation. So this is, yet another example. And the information I've just gone very quickly through there, this is all on our website. So we have case studies for entrepreneurs. We also have something called Our Entrepreneur Profiles, and we're continually adding to this. So please feel free to take a look if you'd like to read up on any of those examples a bit more. Or if you want to read about the other work that our brilliant entrepreneurs are doing, then please do feel free. Is there anybody on the call who is on our programme already that would be happy to share sort of what they're working on and what inspired their innovation? You don't have to, but I just thought I'd give the opportunities, as I'm very glad that some of you have joined us this evening. I can't see any raised hands, so I'll assume not, but there will be time at the end if you want to. Or if there's anybody in general who already has an innovation, you might not be part of our programme, but you want to share what it is and what's inspiring you, then obviously please feel free to raise your hand at any point. So just something to sort of think about and perhaps go away and think about is, in the healthcare settings of which you have experience, are there examples of innovation that you use, or maybe that has helped to treat you, or that you've just come across at any point? And in thinking about those examples, try and think about what key problem or what issue or what difficulty that innovation helps to address or helps to solve. So yeah, it's just something to go away and think about. And I think what we'll do now, a key part of our programme actually is networking. So building a community of like-minded people, meeting people who are fellow entrepreneurs, but also people who work in connected industries that might help you to advance your innovation. And so what we'll do in a moment is go into breakout rooms. And it's just an opportunity for you to introduce yourself. I'll try and do about 3 or 4 people in each room if I can work it out correctly. And just to introduce who you are, what your background is. As I said before, there are people who are students on this call, there are people who are working in the NHS, there's people who are on our programme already. So there's a whole range of people. If you haven't got an innovative idea yet, that's not a problem. You don't have to present that to each other. It's just an opportunity to meet and connect with other people. And then if you can think of any examples of innovation that you've come across, that you work with perhaps in your settings, then do share that as well. So we'll try and do this for about 10 minutes, if that sounds okay. If you have any problems, oh, sorry, I shouldn't have done that, then obviously just leave the breakout room and one of the team will be here. So one moment. Okay, I'm going to try and invite you all to a room now. Let me know if it's not working, anybody. Close the breakout. Thanks, Lucy. So thank you, everybody. I'll just wait for the others to come back in as well. Apologies if I moved you to another room. We're just trying to make sure there were enough people in each breakout room. Okay, I think most people are back. Oh no, not quite. Lovely. Thank you, everybody. Thank you for coming back to the main room. I think you're all joining now. I hope that was beneficial, just to meet some people who are interested in similar things, and hopefully to make some good connections going forward. And obviously, hopefully lots of you will continue to join these sessions, so you'll get to know each other and what you're working on, and give each other some inspiration as well over the coming weeks. So yeah, thank you everybody. So just a few things to sort of consider before we wrap up and have the opportunity for you to ask any questions. If we're thinking about what the key qualities are of a successful healthcare innovation, there's a number of things to think about. Sorry, one second. And feel free to write any suggestions in the chat if you've got any ideas of what you think would constitute a successful innovation. But one of the key things is, as we've mentioned before, this novelty. So is it a completely new idea? Is it something that could lead to a breakthrough in patient care or disease management or operational efficiency? Another key quality is value. Now, this has many different meanings in this context. So it could mean, in a practical sense, how expensive would it be to acquire the innovation? What would it cost to implement it? What would it cost to run it? But also, does it have value in the sense of, does it have a true impact? Does it really meet a need? And what is that impact? Does it improve patient outcomes? Does it enhance quality of life? Does it streamline a particular process? Another key quality is the scalability of it. So often successful healthcare innovations are those that are scalable. So could it be used in other healthcare settings? Could it be used across different trusts? Could it expand across different population groups? And those that are, if an innovation is scalable, it's easily replicated, adapted, and implemented. So think about whether that could apply in the future to your innovation. Another key quality is this idea of empowerment, which we've mentioned a few times this evening. So does it have a positive, empowering impact on patients? But also, if it's something that, NHS staff will be using, does it empower them? Does it free up their time to do other things? Or does it equip them with knowledge to make, better informed decisions? So think about who it's actually giving the power to. And then a final point is the synergy. So how would your innovation work alongside other processes, teams, plans that are in place in particular healthcare settings? And when different stakeholders, so researchers, clinicians, policymakers, and crucially patients, work together, they can combine their expertise, their resources, their perspective, and create a really fantastic solution, i.e. an innovation. So they're just some key qualities to think about. And if you have any others, feel free to drop them in the chat, any ideas that you might have. And then just a final thing to reflect on is, what would the key qualities be for a successful healthcare innovator? And each year we hold an event called the Big Pitch, and that took place in June. And on one of the panels that came on stage, they were asked the question very similar to this: when an entrepreneur walks through the door, what are you hoping to see? And there's a few qualities that were mentioned. So somebody that's creative is really important. So you're looking, you're thinking outside of the box. You're looking for a solution to an issue that hasn't been come up with, that nobody's come up with before. Somebody that's proactive in building a network, and hopefully, you've done a bit of that today. You've met others and who are working in a similar space or with similar aims. Another quality is resilience. So you will, as an entrepreneur, experience setbacks or things that just don't go the way you intended, and that is part of that entrepreneurial journey. And also somebody that's responsive to feedback. So you really listen to what people are telling you about how you can change and improve your idea, your innovation. Also, in turn, somebody that's flexible. So you might need to pivot. You might need to change your idea. So it might not be as, fixed as you initially thought when you first started out on your entrepreneurial journey. And really crucially, they mentioned having this understanding of the problem or the issue that you're trying to solve that has inspired you on this entrepreneurial journey in the first place. So there's just some ideas there. And, if there's anything you can add, feel free to write any ideas in the chat, or if the team want to share any qualities that they think haven't been mentioned there. But yeah, thank you. So I think we'll sort of wrap up there. But we've got about just over 15 minutes if anybody wanted to ask any questions. Just to note, if anybody does need to rush off, so our next session will be next Thursday, again at 6 p.m. And that will focus on really kind of delving deeper into your innovative idea. Doesn't matter if you haven't got an innovative idea yet, hopefully it will still give you some inspiration. But we'll look at how to sort of research it. And Tamsin very kindly will be joining us again. And we'll also have another clinical entrepreneur, Darren Hart, joining us and talking about his journey, his innovation and what inspired him. But does anybody have any questions or anything, or want to share what they're working on, or if you're on the programme already, want to share their innovation, please feel free to raise your hand or put it in the chat. I know somebody's asked, how long does the programme last for? So this is for a 4-part webinar series, but which is across October, but the programme itself, the Clinical Entrepreneur Programme, is approximately a year. So the application round is open in November, but the programme itself wouldn't start until next year and would last for about a year. And I can see, feel free if anybody wants to raise their hand to ask a question. I know there's a few that are coming through in the chat.
There's a couple of questions about eligibility there, Jenny. In Scotland and Wales. So yes, please, yes, you are eligible to apply if you're working in the NHS.
Yeah, so it's that key thing that you have to have a direct contract with the NHS to apply. But if you're joining this as somebody with experience as a patient, then obviously we have the Patient Entrepreneur Programme as well. And there's eligibility criteria for that on our website. And we also have a Dementia Innovators Programme. So if you're working in health and social care, not necessarily for the NHS, but in a health and social care role, then you may be eligible to apply for that if you have a dementia focused innovation. Lovely. Sorry, I'm just working through questions.
There's a few questions. Shall I answer these? So I'll tell you a bit about the programme because my introduction earlier was awful. So I'll go over it a bit more now. And just to answer the eligibility questions here, NHS volunteer, as long as you've got evidence of being an NHS volunteer, you will be part of the workforce as well. If you're a medical student or studying as a healthcare professional that has a direct route into the NHS, so student dentists, medical students, student nurses, pharmacists are also eligible. So yes, that was a question about healthcare students, but your course has to be directly aligned to your route in, if that makes sense. Locum work, you get evidence that locum work and where you're working, that is also okay. Yes, volunteers also, if you've got evidence of volunteering, it's all there. Lucy's just very kindly put up a link about academia, about eligibility criteria. Monica's just asked about academia. If you've got an honorary contract with an NHS trust or organisation, then you can also apply. It'll also be listed in the FAQs that Lucy's just put up there. Going back to, there was a question above that said about the programme from someone called James. So the programme is a year-long programme. As we said earlier, applications are open in November. There'll be some webinars around those applications. So please keep a lookout on the website and also keep a lookout on our social media channels, particularly LinkedIn, which is a really great one for all our news about the programme. Year-long programme, we have around 8 pit stops a year, so that's one roughly every 4 to 6 weeks. So they're 2-day events. You can join, they're blended offering, you can join online or in person. And we deliver all aspects of our curriculum through those pit stops. Complementing the pit stops are webinars, workshops, industry days, international trips. What else do we do? Anyone help me there? There's some other things that we do. Other online, we have an online resources hub as well. So there's online learning to do as well. So So over that year, we offer all manner of different networking opportunities and learning opportunities for you. And the year probably will start in the spring and end in the spring. We start and end, as Lucy's put a lovely video up from one of our panel sessions, with an event called The Big Pitch, where we celebrate achievements of entrepreneurs and welcome the new cohort. Sorry, that was a bit of a ramble there. There is access to, oh yes, and mentoring. Thank you, Amanda Penny. We do offer mentoring as well. So, and there's all sorts of, we get all sorts of ad hoc opportunities and things. So, for example, in a couple of weeks, clinical entrepreneurs have been invited to finish embassy. So there's been some, and there's invitations to different conferences. We often get stands for clinical entrepreneurs at conferences as well. So it's a really mixed bag of really amazing opportunities that you can pick and choose from.
Somebody, Min Ai has just asked if it's a must to have ideas to apply to the programme, and we would say, well, yes, definitely. So you do need to have an innovative idea. It can be, as Tamsin mentioned earlier, an early stage idea, or it can be more advanced, but you do need to apply with your innovative idea. And as part of the application process, you'll be asked to record a very short pitch detailing what your innovation is. So for those early stage one, I suppose the assessors are looking for the sort of potential that you could really develop that innovation. But yes, you would definitely need to have an idea to apply with.
And sorry, I'm just going to jump really quickly in there. We will have dedicated sessions on this. We go through the entire application process, so it's not scary. There will be pitching practice. We will go through each question in detail to give you the best chance when you apply to the programme. We also do full guides around this. So we do a breakdown about what we're asking for, the criteria that we're looking for, and we'll make sure that's all available on the website. Yeah. But please watch out on the events section, because I have just loaded all those webinars on there for the Q&A sessions and the introduction to the programme. Thanks.
Lovely. Well, I think there might be a couple more questions in the chat, but if there isn't anything we haven't answered already, you can of course get in touch with us at any point. Our email address is on that slide there, cep@aru.ac.uk. But as Lucy has said, we will cover the application process in lots of detail in the CEP Prep application Zoom webinar. So yeah, but I'm not sure if anybody has any questions related to the content of today's session or anything like that, but hopefully it's been a bit inspiring, given you some food for thought, and you can go away and either start to think about an innovative idea or try and refine and develop an idea you might already have. But please do join us for our next session. So it's next Thursday, the same time again. And as I said before, we're focusing on sort of really trying to develop that idea. Tamsin will be talking a bit about the research she did to develop her own innovation. And as I say, we'll have another guest speaker as well. But yes, lovely. Well, thank you, everybody. I think we'll leave it there. But do get in touch if you have any questions in the meantime. All right, thank you.
Can I just say thank you, Amanda, for joining? It's lovely to see you here. Thank you for mentoring, and great to see you there.